Hi, I'm Martha Compton. I'm one of the senior veterinary students here at Tufts Cummings School of Veterinary Medicine, and this is my dog Blossom, who's a 5-year-old mutt, which is the best kind. We're going to talk to you today about soft tissue surgery, post-op care. The two big things that you may have are either an abdominal incision or a bandage on one of the extremities. So we'll start with the bandage on the extremities, which we have an example here. With this, the big things to look for are to make sure that your dog's comfortable. So when your dog leaves the hospital, they should not be limping on that leg. They may initially just think it's a little bit weird, but once they're home, if your dog starts limping a couple of days later, that's an indication that there's something going on and you want to get them checked out by the veterinarian. Keeping an eye on the bandage to make sure that everything is good as far as making sure it doesn't slip down. The big things to look for are you want to check the toes. When your pet comes home, you're going to see 2 of their toes hanging out. And if these toes disappear, it means that your bandage has slipped down and needs to be changed by the veterinarian. The other thing to look for is to make sure that you're not seeing spreading of the toenails is kind of a good place. You can see right now that they're right next to each other. If they start to spread apart, that tells you that there's swelling there and that either the bandage is too tight or something's going on with the wound under the bandage. You also want to make sure that it doesn't smell too bad. If there's an odor, you may have a pressure sore, which again is a problem with the bandage, or that the wound under there is potentially getting infected. That's another reason to check back in with your veterinarian who will change the bandage. You want to make sure that you keep the bandage dry at all times. Some of the ways to keep the bandage dry are there are special boots that you can get if you want to go a little bit more low tech. If the bandage is small enough, you can we can send you home with gloves and you just put a glove on the bottom of the bandage, or certainly a plastic bag works. But anytime you take your dog outside, even if it seems dry out, always cover it up to make sure it doesn't get wet, as that will damage the bandage and can potentially cause issues underneath. The other big wounds that you may see is having an incision in the abdomen. If your dog came in for a spay or a foreign body or some sort of other abdominal surgery, looking at that incision, the first 2 days you may see a little bit of bruising around the incision, and that's normal. There also may be a little bit of redness and just a tiny bit of swelling. The doctor will show you what's normal for your incision before you go home. After that time, if you see a lot of bruising, if you see a lot of swelling, the sutures kind of seem to disappear into the swelling, or there's oozing from the wound, that's a problem, and you definitely want to bring your pet back in to see the veterinarian. Check the sutures or the staples every day to make sure that some of them aren't falling out, because again, that's something that will compromise how the wound heals. And certainly a big thing is keep your dog exercise restricted. That's going to help whether or not they have a leg problem or whether it's the abdomen. Keeping them exercise restricted, the doctor will tell you how long they want that for, but that will help everything heal properly. And then medications. Your doctor is going to send you home on medications. They may be in pill form, in which case you can give them in the food, you can give them in a pill pocket or something tasty like a hot dog, depending on how your pet is for them. My dog, you literally just throw them up in the air and she thinks it's a treat, so she gobbles them down before she tastes them. If your pet's a little bit more discerning in their taste and won't take them in anything, you may have to pill them, in which case when you pill, you want to open your pet's mouth and you can take the pill and you want to stick it in the very back of their throat. Close their mouth, hold it closed, and then just massage their throat until you feel them swallow, so that you can make sure that the pill got down and they didn't trap it under their tongue and then they'll spit it out for you. Another way, you may have liquid medication. If you do, they'll give it to you in a syringe, and you want to just stick the syringe in the cheek pouch, squirt it in, close their mouth, and they'll either swallow it or I'll help absorb it. And then e-collars are the last big thing that you will definitely be sent home with, regardless of whether you have a leg bandage or an abdomen incision. With the e-collar, keep it on your pet at all times. Potentially, if they're good when they're supervised, you can take it off then and just keep an eye on them. If your dog's like mine, she must wear it all the time or she will eat her bandage. So definitely keep the e-collar on. If they lick the incision or lick the bandage, that can damage it and lead to infection. So definitely want to keep them away from it.